Gentlemen, if you're a man with pelvic pain, whether it be some deep, burning ache in the pelvis, or if you have penile or testicular pain, you're probably looking for the best way to treat this. So maybe you've heard about trigger point dry needling, and you're curious about what the process looks. Yes, acupuncture needles can go in those painful spots down there, but don't worry, I want to take you through, step by step, what this process looks like before you make any decisions. And through the perspective of a men's pelvic floor physiotherapist, I want to explain how trigger point dry needling can make a huge impact on your pelvic pain, review the research, and reveal the results that I see in my patients in the clinic. First, dry needling has many different names depending on which country your physiotherapist or doctor is from. Names ranging from trigger point dry needling, functional dry needling, or intramuscular stimulation. With needling, the goal is to briefly insert the needle to elicit a twitch response, or a brief muscle contraction in the targeted muscle. This can effectively reset the muscle, and upon the twitch response, one may find that that tense band of muscle is no longer hyperirritable. This often translates to an improved movement experience, which is why it's often the preferred method for physiotherapists. For example, for someone who experiences pain in their hip joint when they go to do a squat, may experience an ease of movement in their hip after the needling of the tight bands of muscle. This method differs from acupuncture, where the needles are left in from anywhere from 15 to 45 minutes. Same needles, different approach. In the clinic, to prepare for trigger point dry needling, I would first grab a bottom and top sheet and prepare the table. The patient would set up underneath the top sheet, either face up or lying on the side. Yes, pants and underwear often need to come off, but not always, just depends on the points. And because this is YouTube, I'm not actually able to show you any demonstrations of pelvic floor needling on real people, so here's a model of the pelvis to explain. The pelvic floor muscles are muscles that are located between the sit bones of the pelvis, and these tense, achy spots you may be experiencing might just be those trigger points located in those muscles. Inside lying, we have good access to the pelvic floor, and to prepare the area, the physiotherapist would use gloves and prepare the skin with stanhexidine, which is an antiseptic solution to prevent skin infections. Once ready, we can find and needle the Puborectalis, a muscle that can be very tense in men with challenges with healthy bowel movements. Next to it is the Pubococcygeus, and next to that is the Iliococcygeus. The depth of the needle can vary depending on the size of the person, and we have to needle through the gluteus maximus and subcutaneous tissues to reach these muscles. And here, a fourth muscle that is easily accessible in the side-lying position is the Obturator Internus. This is actually a hip muscle that can cause tension in the pelvic floor due to its very close proximity to the pelvic floor and pudendal nerve. For the men that I see in the clinic, most people feel a slight tap in the needle, and as it penetrates through the skin and muscle, there's often minimal to no discomfort. As the needle reaches the trigger point, there's this twitch response that occurs, which is that reflexive contraction of the muscle tissues, followed by a wave of immediate relaxation. During that twitch response, some patients can feel for a split second that moderate discomfort, whereas others report it as pain-free and more startling than anything. Keep in mind that everybody's pain levels and sensitivity is completely different. Next, we can target the pelvic floor muscles more responsible for erectile function, which are the Bulbocavernosus and Ischiocavernosus. This can also be done inside lying or in the supine position on your back. Same idea. Needle goes in, muscle reflexively twitches, and then we take it out. Some post-needling soreness can occur up to 48 hours, but oftentimes the men that I see in the clinic only say that this discomfort lasts for about 2 hours. Clinically, for the men that I treat with pelvic pain, dry needling can quite frankly be a very effective tool to release muscles deep in the pelvis, because sometimes it's just kind of difficult to release it with your hands. And if you're choosing to use your hands, for some regions of muscles, they are best released internally through the anus, and for some men, they're just not comfortable with that. So if you're still with me and you haven't ran away from this altogether, let's look at what some of the evidence suggests. Because if we're gonna really stick acupuncture needles down there, it better be effective, right? Like most pelvic floor physiotherapy research, the studies have been conducted overwhelmingly in females. In one study, researchers looked at the effects of manual therapy alone versus a combination of dry needling and manual therapy for women with chronic pelvic pain and associated genital pain during sexual activity. In the 79 participants, the group who received the dry needling and manual therapy had 5 treatment sessions, and the group who received manual therapy alone had 8 sessions. What's notable is that there were statistically significant improvements in pain and sexual function for the dry needling group, despite receiving fewer treatment sessions. Now for full disclosure, at this moment, dry needling for pelvic pain is considered a weak treatment option by the European Association of Urology's chronic pelvic pain guidelines. Despite showing statistical significance, the limitations of most dry needling study methodologies are clear, such as a low sample size, no blinding or sham controls, and of course, despite sharing the same muscle anatomy, we can't extrapolate the findings of dry needling research in females and say this is equally relevant in males. However, weak doesn't necessarily mean ineffective, merely that it's understudied and more robust and randomized controlled trials with stringent study guidelines are necessary. So do we have any research at all about the effectiveness of dry needling in men? It's very minimal. The evidence base is mainly from case reports and extrapolation from broader pelvic pain research. In one study, a physiotherapist treated a 42-year-old man who had a 20-year history of frequent urination, needing to urinate every 30 minutes. Dry needling was performed for 10 sessions, and selected stretching exercises were also provided. At a 3-month follow-up, the urinary symptoms didn't reoccur. A second case report looked at a 27-year-old man with chronic pelvic pain and testicular tension who improved after a program that included dry needling. However, treatment wasn't isolated to dry needling alone. As we can see, we need far more studies looking at dry needling in men. As always, the best supported approach to chronic pelvic pain is to use a multimodal approach. If the goal is evidence-based care and using our best tools for recovery, the best outcomes aren't dry needling and then nothing, but rather dry needling with a proper assessment and treatment plan followed up with the right home exercises. That's the outcome we need. If the outcome of dry needling is to reduce those hyperirritable bands of muscle that cause pain and limitations, we want to follow that up with stretching and breathing techniques in that newfound range of motion. In my other YouTube videos, I discuss the critical skills that are necessary for men to follow up with their improvements they see in the clinic. These are learning how to relax your pelvic floor, learning how to do a reverse Kegel, proper breathing mechanics, home release techniques for the pelvic floor, the appropriate hip, core, and low back stability exercises, and knowing when you might want to include pelvic floor strengthening exercises into the routine. Pelvic pain is highly individualized to the patient's presentation, and above all else, a proper assessment conducted by a trained men's pelvic floor physiotherapist is necessary. So if you're curious and you want to know more about how dry needling works, check out this video I made a while ago, where you can learn all about dry needling through a physiotherapist's perspective. And if you like my content, please hit that like and subscribe button so we can keep showing this to more men who might need to see it. Thanks for watching.